Hi, I'm Dr. Mark Hrymoc, an addiction psychiatrist and board certified in general psychiatry, and addiction medicine. I am the co-founder and chief medical officer of MHC, the Mental Health Center, and our newest division, the Ketamine Therapy Center. Dr. Adnan Majid and I are the two MHC physicians that currently screen patients for ketamine eligibility and oversee their treatment. Thank you for joining us and your interest in our presentation today. I titled this talk Ketamine Therapy and Ketamine-Assisted Psychotherapy to highlight that these are actually two different treatments. Ketamine therapy refers to any use of ketamine as a medication to treat mood disorders. Ketamine-assisted psychotherapy is the name of the combined treatment incorporating both ketamine as a medication plus psychotherapy. We do both at our office at the Cedars-Sinai Medical Towers. So why care about ketamine? All of us have treated patients, clients that hit a point where they just don't seem to get any better, even after a number of medications have been tried or types of psychotherapy have been tried. These are the cases where ketamine can jumpstart progress again. The most research supporting its use is for treatment-resistant depression, and particularly those with suicidal thoughts or behaviors. Ketamine can also be used as an augmentation agent for psychotherapy, meaning that it can make psychotherapy more powerful, and people may have access to insights that they might not have had with traditional psychotherapy. And there's also growing evidence for ketamine being effective for anxiety disorders like post-traumatic stress disorder, obsessive compulsive disorder, and also certain types of substance use disorders. What makes ketamine a great antidepressant? It's very fast acting, often working after just 1 or 2 treatments compared to the 4 to 6 weeks that it can take for a traditional antidepressant pill to work for a person. It also has a unique target, which no traditional antidepressant works on, glutamate, which is a chemical in the brain that is associated with stress and toxicity. Too much glutamate in the brain can actually even trigger seizures in a person. So ketamine helps block this neurotransmitter glutamate. It's also very well tolerated with minimal side effects, and also has anti-self-harm properties. So it can reduce a person's thoughts of harming themselves or even self-harm behaviors as well. And there's only 2 other medications in psychiatry, lithium and clozapine, that have been shown to have this effect in research. Ketamine also has a high response rate in treatment-resistant depression. It works about 70% of the time, compared to if you were to add another traditional antidepressant pill, you'd have a response rate of 15 or 20%. This is a chart comparing the interventional or procedural treatments that are currently available for treatment-resistant depression. So you have ketamine in the left column. RTMS is repetitive transcranial magnetic stimulation. That's a treatment that uses magnetic current to stimulate the brain. ECT is electroconvulsive therapy, which uses an electrical current to stimulate the brain. So all of these treatments stimulate the brain, but just in different ways. Ketamine requires a relatively low number of treatments compared to the others, and a full course of treatment is done in half the time, so 2 or 3 weeks compared to 4 to 6 weeks for the others. A downside of ketamine is that it is not officially FDA approved and therefore not covered by insurance. Monitoring is required for ketamine, and so that actually ends up being the most costly part of a ketamine treatment, and that part is not covered by insurance, but it is for TMS and ECT. And the reason that it's not FDA approved is that it's a generic medication, so no pharmaceutical company will have the financial incentive to complete the millions of dollars worth of research to get FDA approval for it. In general, ketamine is well tolerated. There are some mild coordination issues after a treatment, and that's why a person cannot drive themselves home after receiving a ketamine treatment. We do want them to be picked up by someone. And TMS in general has no side effects. ECT does have significant short-term memory issues that often make it tough for a person to even work during the month or so that they're first getting ECT. The response rate is something like 70% for both ketamine and TMS, and in ECT, it's actually higher, even 80%. So ketamine has both brain and mind effects. Biologically, it works to reduce glutamate by blocking the NMDA receptor, and it also increases BDNF, which is brain-derived neurotrophic factor, and that's a healing factor that promotes nerve growth. Ketamine also has experiential aspects to it too. People do have an experience when they get a ketamine treatment, and a lot of people describe it as a spiritual experience. It is considered a psychedelic medication, and in that process, they might experience kind of lower ego boundaries and therefore sort of enhanced connection with a psychotherapist or other people. And they also increase a rise in hope, which also can be one of the ways in which ketamine helps a person. This is a nice slide showing neurons or brain cells in an animal model of depression. That first slide on the left shows a healthy, robust cell with many full dendrites or branchings off of the main part of the nerve cell. The second slide in the middle shows that same neuron after 21 days of stress, which is basically an animal model for depression. And you can see thinner, skinnier, and branches, and it also has less branches as well. After just one ketamine treatment, though, a day later, that same cell appears vibrant and flourishing again on that rightmost slide. And so with ketamine, we see the rapid reversal of weakening of the brain cell in just one day. On a functional level, ketamine disrupts the default mode network, which is the part of the brain that handles automatic rehearsed processes, things that you don't even need to think to do because you've done them so many times, like driving a car or tying your shoes. But this default mode network is thought to be hijacked by depression, and it can also lead to automatic negative thought patterns in depression and anxiety as well. Thoughts such as, I'm not good enough, or I'm a fraud, or things will never go my way. So ketamine can reduce or dissolve this preconceived programming and allow a person to develop new and hopefully healthier thought patterns. A brief history of ketamine. It was discovered in 1962, and there were human studies done on it. And in those studies, the experiences that the people had made the researcher Ed Domino coin it as a dissociative anesthetic. It was approved by the FDA then in 1970. And because it was so safe and also short acting in its benefit to pain, ketamine became the most widely used battlefield anesthetic in the Vietnam War. Isn't that horse tranquilizer? That's one of the most common first questions that people ask when we talk to them about ketamine. And yes, technically, it is used as a tranquilizer for horses and other animals. There are numerous veterinary applications, but it's also commonly used in people as well. Young people, kids. It's actually the anesthetic of choice that's given to kids under the age of 12 when they're in an emergency room and there needs to be sedation given quickly so that a procedure can be done, like putting in stitches or addressing some other injury. Commonly used in adults as well. And the reason that it's used in those settings is because it does not depress the heart rate or drive to breathe or airway reflexes like other traditional anesthetic medications can. If anything, actually, it stimulates the heart rate and raises blood pressure a bit. And therefore, it's the most commonly used anesthetic worldwide because of this safety profile. This is a slide showing certain pain syndromes treated by ketamine. Most common one is CRPS, complex regional pain syndrome, but it's also used for a variety of neuropathies, occasionally for migraines, and a few other pain syndromes. Ketamine is considered a dissociative anesthetic with psychedelic properties. So let's break apart that phrase there. A dissociative is anything that causes a disconnection or separation from one's body or oneself. In therapy setting, we see it as beneficial because it can kind of reduce the anxiety that a person feels. It may allow them to talk about trauma in a way that isn't necessarily immediately associated with the reflexive pain that they might otherwise experience. Anesthetic is anything that causes a loss of sensation, including physical and emotional pain. Key thing to know about ketamine is that we use sub-anesthetic doses, so 5 or 10% of what a person might be given when it's actually used as an anesthetic. And then the last part, psychedelic, comes from Greek words meaning to manifest the mind. And this is thought that this state allows a person to access untapped aspects of the mind. But this different state is not necessarily considered an altered state. A word that the psychedelic community uses to describe that state is a non-ordinary state of consciousness. It's a state of consciousness which is just different than your typical one. It's not ordinary. And that word is used because people are not just numbed out like they might be with alcohol or benzodiazepines or opioids. And instead, people do describe feeling very clear in their thinking and their feelings, and they describe feeling more open, empathic, and even able to be vulnerable. So what does ketamine feel like? People describe feeling relaxed. They have less defenses up and more perhaps able and willing to talk about things that are tough otherwise. They experience a sense of empathy, warmth, and joy. And there is that dissociated or disconnected sort of feeling that a person describes. A lot of times, like they'll describe it as daydreaming or lucid dreaming. Some out-of-body kind of experiences as well. If a person kind of lets their mind go, they might feel like they're a million miles away. And in general, this state is thought to allow people to have access to those painful memories, thoughts, feelings that they typically might have difficulty accessing without the ketamine on board. And then a person may also experience visions and images that may have special relevance that can be then processed. So in my experience in working with people, they can still experience sadness, tears, joy, and empathy, but the increased empathy and perspective shift that accompanies it allows it to then exceed their default pain, anger, fear that may just reflexively accompany the traumatic memory. And this allows them to reflect on trauma in ways that they might not normally be able to do. With ketamine on board, if a person feels uncomfortable or distressed by a topic, they can more easily shift their attention to a different subject rather than spinning out or feeling increasingly emotionally dysregulated by a certain traumatic memory or thought. This is a slide showing the chemical structure of ketamine. When any medication is made in a lab, We get both the right and left-handed versions of a molecule. So these are not identical, but they're mirror images, just like our right and left hands are mirror images of each other. Generic ketamine is a 50-50 mixture of these two enantiomers, whereas Spravato is a purified form of ketamine that is only the S-ketamine. So the schedule for Spravato is 2 treatments a week for 4 weeks, and then 1 treatment a week for 4 weeks. And then the booster schedule is determined as needed. So Spravato actually requires more treatments than generic ketamine, 8 in the first month and 4 in the second month. So it actually requires 12 treatments over 2 months compared to the 6 treatments over 2 or 3 weeks for generic ketamine. Spravato is FDA approved for treatment-resistant depression who have failed at least 2 traditional oral antidepressant pills. Because it was studied while people were taking a regular antidepressant pill, it must be administered with one. And Spravato also has a REMS program associated with it. REMS stands for Risk Evaluation and Mitigation Strategy. And that's basically a restricted distribution program. So it's a very highly regulated medication. It can only be administered in a certified healthcare setting with 2 hours of monitoring after it's given, and then notes from each session actually need to be sent to the Spravato REMS program. So we do offer Spravato in our office as well. So why did we start the Ketamine Therapy Center? We're a psychiatric clinic with 10 subspecialty trained psychiatrists. So we see a lot of treatment refractory depression, anxiety, and trauma. And most ketamine clinics that we saw do not incorporate psychiatry or psychotherapy and really use an anesthesia model where patients are alone when they're given the treatment and then later recover from its effects alone, as if they were in a post-operative recovery room. And we felt it was important to have nurses with formal psychiatric training or experience that stay with the person and that can be supportive during that experience. We also wanted to be able to easily add ketamine-assisted psychotherapy, regardless of what route of administration a person receives their ketamine. Other clinics that we saw offer ketamine as a psychedelic adventure under the pretense of providing a medical treatment. And we understand that people may use psychedelics recreationally or for personal growth, but as healthcare providers licensed in California and as part of the UCLA and Cedars-Sinai medical communities, we see our charge as being to treat medical and psychiatric disorders. A vital part of our mission is to practice in a way that's consistent with the values of the conventional Western medical community, but also the psychedelic community, and ideally even serve as a bridge between the two. And so we do strive to be an ethical ketamine center where we also discuss non-ketamine treatment options. Conventional therapy and psychiatric medications do help many people, and there's a reason that people need to qualify as having treatment-resistant depression or treatment-refractory depression to receive ketamine or those sort of bigger kind of procedural treatments for depression and other mood disorders. And we also put a high value on communicating and collaborating with a person's treatment team, because when a person has a tough to treat condition, they'll very often have a therapist and maybe even very involved physician and other people that are part of a treatment team. And we see collaboration as being really valuable in those toughest to treat patients. So a little bit about our consent form for ketamine. We do say that ketamine often works quickly, but one treatment lasts about 1 week. And so that improvement lasts longer when they're stacked as 6 treatments, which we call like an induction series of treatments that are given over the course of 2 or 3 weeks with at least 1 day in between each treatment. Additional booster sessions will be necessary every few months afterwards. We tell people to prepare to need to get those booster sessions every 1 to 3 months. I've had a few people that say that one round of ketamine treatments helps them for 6 or 12 months, but that's definitely an exception. And most people do need booster sessions every 1 to 3 months. Our consent form also describes generic ketamine as being off-label for the treatment of depression, which means that it's not FDA approved, and therefore most insurance companies will not cover it because it doesn't have that formal FDA approval. What are the side effects of ketamine? Dissociation, feeling kind of out of body. Some nausea can happen with ketamine, which I see as sort of a decreased threshold for motion sickness. And so part of the reason we ask for people not to have any food 4 hours before or a lot of fluid in the hour before, just to kind of minimize any potential for nausea. But people, if they kind of follow those rules, and they don't experience a lot of nausea. It can raise heart rate and blood pressure, usually mild, equivalent to climbing 2 flights of stairs or so. But that's also why we monitor their heart rate and blood pressure with a continuous vital sign monitoring system. And a person may have illusions or dreams that may seem real, and often ketamine-assisted psychotherapy can help a person navigate those, thoughts and different experiences that they might have while in that psychedelic state. There are rare side effects of inflammation of the bladder. So if a person has change in urinary habits, we definitely ask them to let us know. And like any antidepressant, paradoxically, sometimes a person's mood may get worse. And so we just want to monitor for any worsening of depression or anxiety, or any thoughts of self-harm actually coming up after the treatment. But those all are rare side effects. Safety precautions. So I mentioned the food and drink part of things. And because ketamine can impair coordination, we do want people to not drive for the rest of the day, basically sleep off the effects of the medication. If possible, we recommend a friend or family member, basically someone that they're comfortable with and familiar with, pick them up. We've had people do Uber, rideshare, taxi, etc., and do okay with that as well. Everyone gets a drug screen at their first visit, just because we want to make sure there's no surprises, other substances in there that we're kind of not expecting anyway. Contraindications or cautions should be exercised in people who have any current manic or psychotic symptoms. There actually is some debate about this, and there was recently a big paper in the recent American Journal of Psychiatry really calling that contraindication into question. But that is just something to really watch out for. We certainly want to make sure that ketamine is not worsening anything about a person's mental state. High blood pressure that's out of control first needs to be controlled before we give ketamine, because it can raise heart rate and blood pressure. Active addiction is a reason not to give ketamine. We certainly don't want it to be part of a bigger problem that a person might have. And then you could read the others as well. So in general, ketamine does have a low addiction potential. When I talk to patients, I try to clearly establish the difference between a medication and a drug. And so a medication is something that's given in a medical setting after a good faith evaluation and discussion with a doctor, where there's a disorder that's identified, that's the target of treatment, and ketamine is deemed as a treatment that will have more benefits than potential risks. Whereas a drug is something that's used in a recreational setting without supervision of a doctor. And there's a big difference in just the context of the two. A few quotes from studies on ketamine and potential risk of addiction. The Studies where Spravato got FDA approval found that there's a, quote, extreme low risk of addiction or drug-seeking behavior when given in that medical setting. There was a consensus guidelines published by 3 major anesthesia/pain professional organizations that said there's little to no evidence that ketamine has an increased, the exposure to ketamine in a hospitalized setting increases the chance of addiction to ketamine. And there are even a few small studies by Dr. Dakwar at Columbia University showing that it may be beneficial for people who have cocaine use disorder and alcohol use disorder, or addiction, basically. These are some medications that may blunt ketamine's benefit to depression, anxiety, etc. Latuda, Lamictal, and benzodiazepines. If a person is taking any of these medicines, if they're very stable on these medicines and can go off for 12 or 24 hours before treatment, we tend to recommend that. But if they've tried that before and they're deemed like very necessary to keep on a regular schedule, we do keep them on. There's only anecdotal evidence that these medicines can decrease ketamine's benefit. So that means a few people have sort of reported it, and they've actually tried to replicate this purported phenomenon that ketamine may reduce these medicines might reduce ketamine's benefit, and they were not able to replicate that in studies. Ketamine-assisted psychotherapy is any therapy that occurs during the medication session or even after the ketamine session, which could be the same day or even the next day, would still count as ketamine-assisted psychotherapy because the person still has ketamine floating in their system. And therefore therapy, when there is ketamine in the system, can have a person to have lower defenses and more openness to change. In giving therapy, we might use a lower dose of ketamine, maybe 0.3 to 0.5 milligrams per kilogram, instead of the usual 0.5 milligram per kilogram dose. So that 0.3 to 0.5 dose range is considered a psycholytic dose, as opposed to a full psychedelic dose where there's more dissociation, and it can actually be tough for a person to speak or participate in therapy when their blood levels are higher. Psycholytic is definitely not defined as mind loosening, so there's some dissociation, but in general, patients maintain that capacity to speak and have a sense of situational awareness. How does CAP differ from traditional psychotherapy? Main difference is that there's an experiential medication session to process. There's an actual experience or journey. And like every journey, we do want a person to be prepared, and there's meaning that therefore can be derived from that journey. Preparation involves creating an intention and something for a person to work on during that session, and then is the main theme that is addressed in the integration session afterwards. There might be other images or visions that a person encounters that are discussed in that integration session. And the goal is to help a person re-enter their lives and integrate the lessons that they've gleaned from their ketamine sessions into their regular day-to-day life. We often recommend self-care, journaling, connecting to nature as also activities that a person should engage in. And if a person has a tough session, we'll follow up with them within 1 or 2 days, even if there isn't an integration session scheduled afterwards. So this is a slide showing a study done by Wilkinson and his group at Yale, where subjects received ketamine in the first 3 weeks, and then the responders from that group were split into 2 different groups: those that received CBT, cognitive behavioral therapy, and those that didn't. And CBT was chosen because it's a very manualized or standardized form of therapy that can be replicated for the purposes of research studies. And what they found was, with the passage of time, those that had therapy actually experienced the benefit of ketamine for longer than the people that didn't. So this is a graph of the depression severity, and you can see that it's lower. The orange line is lower than the blue line, which is treatment as usual. So we created this infographic to illustrate the model of ketamine therapy at our clinic. At the end, you'll see the familiar 3 stages of any psychedelic therapy: preparation, journey, and integration. But in our clinic, before we start that, patients make 2 choices. One is the route of administration, and the other is the sitter, or the person that sits with them during the sessions. So route of administration, IV is nice for people who may want the option to stop or pause infusion. IV means intravenous ketamine that's kind of dripped over the course of 40 minutes into a person's system. It has high bioavailability and is considered the gold standard, in that there is the most evidence supporting its use in the literature. IM, or intramuscular injection, is an alternate route of administration that was really more commonly used by psychiatrists who didn't have access to IV equipment or staff to assist with establishing IV access and operating an infusion pump. And they would therefore inject ketamine with a needle. There's 95% bioavailability, so 95% of the medicine gets into the person's system, so pretty close to IV. The benefit is it's simple, and it can be therefore given as a single injection, beneficial for people who have poor IV access, or who just don't want to have an IV line kind of in their arm during the course of the treatment. And it can be given as 2 separate injections, 10 minutes apart, to mimic what an IV infusion does. Spravato is another form. We talked about Spravato already. It's a nasal spray with 48% bioavailability. Lozenges we don't often use because they have lower bioavailability and a lot of variability in the ketamine, therefore, that gets into their system. There's also the least evidence supporting its use. It also requires a very reliable patient, because this is a type of ketamine that a person has, therefore, access at home to. But for those reliable patients, it can be considered as a mini infusion, something that a person can still get a ketamine treatment for, maybe with, let's say, half the potency as a traditional in-office treatment. So the next step at our office is to have the patient choose who the sitter with them will be. So a word about set and setting. These are familiar to the psychedelic community. Set refers to a person's mindset or their inner emotional climate, like their thoughts and expectations walking into a treatment specifically. And the physical space is the setting. The physical space being our job to create an office that is warm, inviting, comfortable, and professional. And these 2, set and setting, are the 2 most important determinants of the type of experience a person has in their treatment. It's at this stage that a patient makes the decision to receive ketamine primarily as a medication treatment, which ultimately is what most of the research evidence supports, or to add on ketamine-assisted psychotherapy, in which case they'll have a therapist who's sitting with them. So in our office, a nurse is always giving the medication, but if even a person is not getting ketamine-assisted psychotherapy, we do have a nurse sitting with the patient, so they're not alone. We want all patients to engage in some process of preparation for the medication sessions. They may not be doing formal ketamine-assisted psychotherapy, but they will still undergo a psychedelic experience. So we want them to get the most they can out of it. If they are doing formal ketamine-assisted psychotherapy, they'll have a therapist who's having preparation sessions where they're learning about the patient, and therefore builds trust and rapport with the therapist as well. And the therapist also does some psychoeducation about what to expect in the medication sessions. These are the items that we recommend people consider bringing to make themselves more comfortable during a treatment, like a pillow or blanket. Music is important because it can help guide a ketamine experience, but we don't want too much structure in the music, and that's why we say nothing ideally with heavy beats or vocals in it. We want the person ultimately to feel open to wherever the medication may take them, like ambient or classical music. And this slide on the left shows ketamine-assisted psychotherapy in the medication session. You could see the therapist giving a warm, supportive touch to the patient who's getting the treatment. And in the picture on the right, you see a person who's getting ketamine just as a medication-only type of treatment. And he's actually wearing the caretaker device that we use in our office, which is a continuous non-invasive vital sign monitoring system, which allows us to continuously track a person's heart rate and blood pressure without the intermittent squeezing of a blood pressure cuff on the arm. Ketamine is administered over the course of 40 minutes. The main part of the experience lasts 90 minutes or so, and the patient is in our office for a total of 2 hours. And the last step, the integration time period, is when we want people to take the insights that they gained from their medication sessions and implement them in their lives as enduring positive changes. If they're doing formal ketamine-assisted psychotherapy, they'll have 1 or more sessions with the therapist to assist in this process and also to prepare for the next medication session. And we encourage all patients to practice good self-care after treatments, engaging in reflective or creative activities like journaling, music, and art. And we also encourage everyone to strengthen their connection to nature and the world in which we all live. So to sum up, when to consider ketamine for a patient, the biggest indication is for treatment-resistant depression, but also bipolar depression as well. There is growing evidence for ketamine being effective in anxiety disorders like PTSD and obsessive compulsive disorder, and some beginnings of inklings of evidence for being used to treat addiction issues. Current medications may not be giving adequate relief, and so those are patients for whom ketamine can be a medication that actually does help, or if the current meds come along with a side effect burden that's difficult to manage. Any self-harm thoughts or behaviors can also get better with the ketamine treatment. Or if a person is stuck in psychotherapy, ketamine can augment the benefit of therapy. Take-home points: ultimately, ketamine is fast-acting. It's very safe and well-tolerated. It's more effective in treatment-refractory disorders than traditional oral antidepressant medications. It can reduce suicidal thinking and behaviors, and has a unique biological and also experiential mechanism of action. And ketamine can create a major perspective shift in a short amount of time, which can also be augmented by ketamine-assisted psychotherapy. This slide contains the references that were used to create this presentation. And I wanted to thank you once again for your interest. Feel free to email me if you have any questions. Thank you.